Do you have leg pain? Does it feel like a hot iron poker is sticking right in your backside? You might have sciatica, and it can be extremely painful. It can keep you up at night, it can keep you from doing all the activities, it can even affect the way you walk. So what I'm going to do is I'm going to show you some stretches, some very effective things that you can do to help calm it down before you get assessed. Okay? So let's start off with what is sciatica. The sciatic nerve is formulated by the branches of the nerves that originate from the lumbar spine. As the spinal cord travels down the spine, branches of nerves come off that travel out and form a common bundle that makes up the sciatic nerve. Okay, so you can see that on this nerve chart. All of these bundle of nerves come out and they form one common ribbon of nerve that comes all the way down and goes right down into your foot. Some of you have complained about having problems in your hips where you start to feel this diffuse pain that travels out into the lateral part of your hip. Some of you talk about getting that real pain down in the back of your hamstring. And some of you may even be experiencing some of that pain in the outside of your calf. Those are all common signs and symptoms of sciatica. All right? Like I said, it can be extremely painful. It can affect the way in which you walk. Sometimes for some people, just even their ability to stand or sit can be severely compromised. So what I want to do is I'm going to show you some stretches, some very simple things that you can do right now so that you can help get some relief. Start by laying flat on your back. Pull your right knee in towards your chest while trying to keep your low back flat and not arching. Stay in this position for upwards of 30 to 40 seconds. Now we're going to switch legs. So we'll lower the right leg down and we'll bring the left knee in towards the chest. Do your best to try to push the back of your extended leg down towards the floor. After pulling in your left leg, you're going to pull both knees in towards your chest and hold for 40 seconds. Again, continue to work on keeping your low back as flat as possible. Next, lower your left leg straight and pull with your left hand, pull your right knee across the midline of your body, trying to keep your shoulder blades as flat to the floor as possible. Hold for 40 seconds and then switch to your left side. In this stretch, you should be feeling it all the way through your buttocks and into your low back. Last, we're going to thread the needle. If you can, cross your left ankle on top of your right knee and reach through between your legs and grab onto your shin. If you're unable to grab your shin, simply grab through and try to grab the back of your thigh as I show here. Once again, you want to hold for 40 seconds and you're going to do your very best to try to keep your low back as flat as possible. Next, we're going to put the heels of our hands right up as close to the top of our thighs where the crease of your thighs meets your pelvis. In this position, you're going to try to extend your arms as far as possible, lifting your rib cage up and away from your pelvis. In this position, take 12 to 15 deep breaths. All right, so now that you've got those exercises, what I want you to do is I want you to work on doing those on a daily basis. You can do them upwards of 3 to 4 times a day, no problem at all. They're going to be good for you even if you have a history of sciatica and you're just looking to keep your hips flexible. If you found this video helpful, what I'd like you to do is just click the button below and hit share. Maybe you know a friend, a family member, or a loved one that you would like to share that with, who you know that is struggling and suffering. And of course, one of the best things that you can possibly do is get a professional assessment by a chiropractor so that you can find out exactly what is the root cause of the sciatica. All of the exercises that I just showed you are really functionally just helping you to stretch out some of the tissues as a result of the injury, okay? So what we need to do is, we haven't sorted the cause, what we've done is try to manage some of the effects of that. And that's what the stretches are all about. To really get to the cause, we've got to pinpoint what exactly is causing the pelvis and causing the nerves to become irritated, ultimately affecting and causing that sciatica. All right, my name is Dr. Craig Hazel from Synergy Chiropractic in Kanata, Ontario. I hope this was helpful. Again, if you have any comments, feel free to ask questions. I'll be happy to answer. All right, take care.